صباح الخير يا دكاترة. هكمل معاكم الجزء الثاني من المحاضرة بتاعة الفايبرينوليتيك drugs اللي هي the drugs used in treatment of bleeding. ايه الدروجز اللي ممكن نستخدمها علشان نوقف الهيموراجيك ستيتس او نوقف البليدنج؟ عادة دي بتبقى these are substances that promote coagulation. دي بتبقى drugs بتوقف لي البليدنج عن طريق ان هي بتبروموت الكواجيوليشن، يعني either ان هي بتزود الكواجيوليشن فاكتورز، تمام، او بتبقى antidote to the drug that caused bleeding اساسا. يعني مثلا زي ال fresh whole blood transfusion or plasma transfusion. Usually the fresh blood transfusion or plasma transfusion provides all the factors needed for coagulation. And these are the basis for the therapy for deficiency of any clotting factor. يعني لو حصل إن البيشنت ده عنده bleeding or this patient has deficiency for one of the coagulation factors, already عنده disease وعنده deficiency for one of the coagulating factors، كفاية إن أنا أديله fresh أو whole blood transfusion أو plasma transfusion، لأن usually بيبقى فيهم كل clotting factors وال coagulation factors needed to stop the bleeding. تمام، بس طبعا الحاجات دي this carries the risk of transfusion reaction. البيشنت ممكن يدخل في allergy وفيفر وحاجة اسمها transfusion reaction، فبالتالي مش بنحب قوي ندي fresh whole blood. وبيبقى فيه بعد كده حاجات تانية for سواء local أو systemic to stop the bleeding، هنشوفها مع بعض. Vitamin K is one of the very important vitamins or drugs used to stop the bleeding. احنا بنتكلم أول حاجة we are talking about the systemic. هنا hemostatics، احنا عندنا systemic and local. فبداية السيستميك اللي بسميهم الcoagulants، أول حاجة وأهم حاجة فيهم هو vitamin K. The most important is vitamin K and we will discuss it in details. طيب عندنا غير vitamin K we have fresh blood transfusion. زي ما قلت fresh blood transfusion بيسبلاي كل الكواجيوليشن والclotting factors اللي ممكن توقف لي bleeding that could stop the bleeding in any patient، بس it carries the risk of transfusion reaction. في كمان عندنا حاجة اسمها fresh frozen plasma. fresh frozen plasma بتبقى بس just plasma and the plasma provides all the clotting factors needed to stop the bleeding. We also have the protamine sulfate. انتوا خدتوا البروتامين sulfate مع anticoagulants. You already discussed the protamine sulfate in the anticoagulant lecture. Protamine sulfate is the antidote of heparin. يعني لو البيشنت ده كان already ماشي على heparin, if this patient is already on heparin therapy, okay, and the patient suffered severe bleeding, ممكن ندي protamine sulfate. Protamine sulfate can be given as an antidote to heparin to stop the bleeding. كمان عندنا الانتيفايبرينوليتكس اللي هم الامينوكابرويك acid والترانexamic acid. We already discussed in the fibrinolytic lecture that there is a pathway or some drugs that inhibit the pathway for fibrinolysis. For fibrinolysis to occur, we said قلنا in inactive plasminogen has to be activated and transformed into plasmine that cause degradation of the fibrin in the thrombus or the fibrin clot. Okay, we have two drugs that can inhibit the activation of plasminogen into plasmine اللي هما aminocaproic acid and tranexamic acid. So if a patient is suffering from bleeding due to fibrinolytics or even from bleeding generally from bleeding يعني usually حتى aminocaproic acid and tranexamic acid can be used. They are usually used by the dentists to stop bleeding, locally by the dentist to stop bleeding, for example from an extracted tooth. Okay, we also have the cryopreceptor. الcryopreceptor ده عبارة عن جزء من fresh frozen plasma. الكرايو ده is a part of the fresh frozen plasma proteins that are rich in certain coagulation factors. Cryopreceptor ما بيبقاش فيه كل ال coagulation factors، بيبقى فيه أجزاء بس coagulation factors معينة. Okay, it doesn't contain all the coagulation factors. It contains only factor 8, factor 13, the von Willebrand factor and fibrinogen بس. في كمان الدازموبريسين acetate. الدازموبريسين ده is a synthetic form of a hormone found naturally in our body اسمه vasopressin. Okay, والvasopressin أو الدازموبريسين it stimulates the release of some coagulation or clotting factors like factor 8 and von Willebrand factor from the endothelium. فبيساعد على stop of bleeding. There is also the human fibrinogen and anti-hemophilic globulin 4 that is used for treatment of hemophilia, which is a pathological condition, genetic disorder that presents with bleeding, deficiency of clotting factors and bleeding. And there is the vitamin C in cases of vitamin C deficiency. احنا عارفين ان في حاجه اسمها بروتين اس وفيتامين سي، دول natural anticoagulants in our body. في حالات الفيتامين سي deficiency زي السكيرفي اوكي ممكن يحصل bleeding، وهنا ممكن يتعالج بفيتامين سي. The illustration of how the cryopreceptor is formed. The cryopreceptor is part of the fresh frozen plasma, which is in turn a part of the whole blood transfusion. Okay, يعني الدم كله بيبقى عندي ال blood transfusion، ممكن جدا أطلع منه ال fresh frozen plasma that contains all the coagulation factors needed to stop the bleeding, and from the fresh frozen plasma we can form the cryopreceptor. أهو. This is the cryopreceptor that contains only some factors like fibrinogen, von Willebrand factor, factor 8 and factor 13. Let's discuss vitamin K in some details because vitamin K is very important. Vitamin K, the fat-soluble vitamin, تمام? Usually found in leafy green vegetables زي السبانخ, البروكلي and lettuce اللي هو الخس. Vitamin K أهميته إن هو it's very important for some factors زي البروثرومبين و factor 7, factor 9 and factor 10. وبيدخل كمان في involved, it is involved وبيبقى essential factor في blood coagulation, في bone metabolism, في regulation of various cellular functions. تمام؟ it's a very important vitamin. It is used usually to stop bleeding. The dietary requirements منه is very or are very low. ليه؟ لأن this vitamin is synthesized naturally inside our body in the GIT. The bacteria inside in the GIT synthesize vitamin K. البكتيريا اللي موجودة naturally في GIT بتاعتنا هي بتصنع لوحدها فيتامين K، وعشان كده احنا مش بنحتاج منه كميات كبيرة من بره. تمام؟ في two natural forms exist of vitamin K. vitamin K1 وده اللي بنقول موجود في الأكل, it's found in food, وده بيبقى available clinically متصنع already synthesized and available clinically in oral and parenteral forms. And we have vitamin K2 that is found in human tissues and is synthesized inside the intestine by the bacteria flora. Vitamin K1 and 2 هما الاثنين they require bile salts for absorption from the intestine. وعشان كده لو في patient عنده مشكلة في البنكرياس وعنده مشكلة في البايل salts synthesis بالتالي هيبقى عنده مشكلة in vitamin K absorption. In vitamin K absorption وممكن يدخل في bleeding. It needs bile salts for its absorption. We said the vitamin K1 it's given to all newborns. Vitamin K1 ده مهم جدا للنيوبورنز ليه؟ To prevent the hemorrhagic disease of the newborn. لأن بيبقى بالذات premature infants بيبقى عندهم فيتامين K deficiency نتيجة إن هم لسه الليفر بتاعهم بيبقى premature، وبالتالي ما بيستجيبش أو ما يعني مش بيتعامل مع فيتامين K normally زي الادلتس. أوكي، وممكن يدخلوا في حاجة اسمها hemorrhagic disease of the newborn. So it's given to all newborns, especially the premature. في كمان form من فيتامين K بيتصنع synthetic form اسمه فيتامين K3 بس ده بيبقى برو فيتامين كأنه برو دراج. It needs to be converted or activated to the active form inside the liver. It needs activation inside the liver. As we said, in the vitamin K, the essential factor in the blood coagulation, bone metabolism, and regulation of various cellular functions, and it's very important vitamin. It's used to stop bleeding problems. إمتى؟ في الحالات ليه بيجي bleeding من vitamin K deficiency؟ في حالات ال decreased absorption of vitamin K. تمام؟ Or the inadequate intake. Sometimes in patients suffering from malabsorption syndrome, which is a disease or syndrome, بيبقى الintestine فيها unable to absorb important vitamins or food properly, or if this patient is taking حاجة اسمها liquid paraffin. لو العيان ده بياخد liquid paraffin, usually the paraffin is used as anti-constipating agent for patients suffering from constipation. لو البيشنت بيعاني من إمساك بيدوله البارافين ده علشان يساعده against constipation. بس البارافين ده inhibit the absorption of vitamin K and other fat soluble vitamins زي vitamin A و D و E. Okay. Decreased synthesis of vitamin K, bleeding due to decreased synthesis of vitamin K from intestinal flora. لو العيان عندي ماشي على antibiotic broad spectrum زي حاجة اسمها cephalosporins أو cephalosporins بنقول عليهم مجموعة من الantibiotics. If this patient is already on oral broad spectrum antibiotics, these antibiotics destroy or kill the intestinal flora, the bacteria found inside our intestine. الانتيبيوتكس دي بما انها برود سبيكترم بتقتل البكتيريا اللي موجوده في الانتستين عندنا، وبالتالي البكتيريا دي مش هتصنع الفيتامين K. These bacteria will not synthesize vitamin K and there will be a decrease in vitamin K and the patient might enter in bleeding bouts. Decrease the hepatic utilization of vitamin K. The liver cannot utilize vitamin K properly because of a liver disease, or in the newborn, as we said, cause liver بتاعهم their liver is immature. Again, in hypoprothrombemia states, with hypoprothrombemia, which is a decrease in the prothrombin, this might be secondary to salicylates intake, زي aspirin intake. Aspirin decreases the prothrombin level, and the liver disease. Liver disease cannot synthesize, in the presence of liver disease, the liver cannot synthesize prothrombin. Users of vitamin K antagonist. انتوا أخدتوا already في anticoagulants, the oral anticoagulant warfarin. The antidote of warfarin is vitamin K. Like the antidote of heparin is protamine sulfate, the antidote of warfarin is vitamin K. So these are the cases that vitamin K is used for. We also have the local hemostatics. The local, we were discussing the systemic, like we said, vitamin K, fresh blood transfusion, fresh frozen plasma, cryopreceptor. We have the local hemostatics here. The local hemostatics are either the physical method by application of pressure, بس اضغط على الجرح لحد ما البليدنج يقف, the physical method. We have the vasoconstrictors like adrenaline. تمام. الادرينالين is supplied for ampoules, in ampoules. Okay. Sometimes a patient with epistaxis, bleeding from nose, العيان اللي بيجيله epistaxis أو bleeding from nose, يقول لك اكسر له أمبولة أدرينالين على قطنة وحطها intranasal عشان توقف epistaxis. Okay. Patients with epistaxis, you can put few drops of adrenaline on a cotton piece and insert it intranasally to stop the bleeding from nose. We have also something called astringents like tannic acid. Okay, these are found in like drops, sold as drops. They cause precipitation of the blood proteins. They can be put directly on the site of bleeding and they can stop bleeding. عندنا شوية حاجات كمان بنسميها local coagulants زي thrombin powder, fibrin sheet, fibrin glues, gel foam or oxidized cellulose. I'll show you the figures. This is, for example, the tannic acid that I told you about. Okay, it's sold in the form of drops. بيتحط directly على المكان bleeding. It's put directly on the bleeding site. This is the thrombin powder. it can be applied topically برضو on the bleeding side. دي الفايبرين sheets مجرد ما تحطها on the bleeding side يوقف bleeding. This is the epinephrine ampoule. This is the fibrine glue. It's a glue بيبقى عامل زي الصمغ كده. It's put directly on the bleeding site بيوقف bleeding. دي compression method. ده oxidized cellulose. Oxidized cellulose واضح هنا دكاترة الأسنان dentists use this to stop bleeding from an extracted tooth, and the gel foam also can be put directly on the bleeding side to stop bleeding. So again, to sum up, we have the drugs that stop bleeding, either systemic or local. Systemic hemostatics, the most important is vitamin K. We have the fresh blood transfusion, fresh flows in plasma, cryopreceptor and clotting factors. We have the local or local hemostatics زي الcompression أو الابنفرين أو the others like thrombin powder, like the tannic acid, the fibrine sheets, the gel foam, the oxidized cellulose, the fibrine glue, they all can stop bleeding locally. Thank you all.